So good morning to all. This is regarding the medical emergency and the Mental Health Care Act 2017, and what are the provision to do in the emergency and what not to do is postulated in Mental Health Care Act, uh, and we will look what is Mental Health Care Act and how a uh, doctor of emergency medicine should take care of the patient of psychiatrically ill patients who are presenting in the medical emergencies. What are the provisions and what are the chapters are there? So, for brief of Mental Health Care Act, it was enacted in uh, May 29th, 2018, and this is the promulgation of MHCA, and this is because of the UN convention, and the countries of UN convention should fully aligned with the UN convention. So, Mental Health Care Act was introduced uh, under the aegis of UNCRPD, and it focuses on the promotion of rights to community, including dignity, rights to community inclusion, dignity, autonomy, empowerment, and recovery for all the people with mental illness. So the preamble of the Act has two parts. Provide for mental health care and services for person with mentally ill, and to protect, promote, fulfill the rights of such person during the delivery of mental health care and services. So we will go through the chapter wise. This has 16 chapters. So chapter 1 is preliminary, which talks about the definitions and titles and all. So two things which has to be noted specifically in the chapter 1 is what is mental health establishment. So which building or institution should be considered as mental health establishment under MHCA. So health establishment includes Ayurveda, yoga and naturopathy, Unani, Siddha, homeopathy establishments by whatever name called, either wholly or partly, meant for the care of person with mental illness. Wherever the person is treated for mental illness, and regardless of the modern science, all the institution, all the establishment of other pathies will also be considered as mental health establishment, which is established, owned, controlled, or maintained by the appropriate government, local authority, trust, whether private or public corporation, cooperative society, organization, or any other entity or person, where person with mental illness are admitted and reside at. Wherever the mentally ill person is admitted under the roof for treatment of medical illness, and the person is residing in the building, those building whichever is run by the government, private, or in the personal capacity will be considered as mental health establishment. This is applicable for rehabilitation centers or also which are temporarily or otherwise established, including any general hospital, general nursing home established or maintained by the appropriate government authority and so on, but does not include a family residential place where a person with mental illness resides with his relatives or friends. So this is the idea about the mental health establishment. Now, who is the mental health professional? So mental health professional under MHCA is a psychiatrist as defined in clause 10, a professional registered with the concerned state authority under section 55, a professional having postgraduate degree in Manovigyan evam Manas Roga, or postgraduate degree in psychiatry, in homeopathy, or a postgraduate degree in Unani in Molizat, which is known as Nafasiyat, and postgraduate degree Siddha in Sirappu Murutvam. So any pathy has a postgraduate degree in uh, for treating, for the purpose of treating of mentally ill patient, will be considered as mental health professionals, not only the psychiatrist only. So further, what is the clause 55, which is defined in the uh, line 2 of mental health professionals. So 55 says that registered clinical psychologists, mental health nurses, psychiatric social workers in the state to work as a mental health professional and publish the list so and so on. So psychologists, nurses, social workers who are trained in mental health uh, area of the psychiatry, they will also be considered as mental health professionals. Chapter 2 talks about mental illness and capacity to make mental health care and treatment decision. So this has two part: determination of mental health, capacity to make mental health care and treatment decisions. Chapter 3 is about advanced directive. So one should know what is advanced directive. Advanced directive uh, advanced directive is a document which is given by the person who is mentally ill, and this is regarding how the person wishes to be cared for and treated for mental illness in mental health establishments, and wishes not to be cared for and treated for mental illness. So this is an advance directive which is documented by the mentally ill person in a lucid state, and he can specify which thing to be done to him when he is being treated and what to not. The individual or individuals in order of precedence he wants to appoint as nominated representative as provided under section 14. So advance directive is also for appointment of nominated representative who can take care of the treatment of the person when he is not in the capacity to make decisions. For emergency treatment, advance directive is not applicable. The advance directive shall not apply to emergency treatment given under section 103 to a person who made the advance directive. Liability of mental health professionals in relation to advance directive is: a medical practitioner or mental health professor shall not be held liable for any unforeseen consequence on following a valid advance directive. For example, a treating doctor is following the advance directive what the person has said in their directive how he should be treated and how is not. For example, ECT is required and the person has written in the advance directive that I should not be given ECT during my treatment phase. So the treating doctor or professional is has to comply with that advance directive and not to give ECT if it is very much indicative in the condition. If any untoward consequence occurs, the treating doctor is not held liable for the treatment which is stipulated in the advance directive. So chapter 4 is regarding the nominated representative, how he is nominated, who can be nominated. There is a long discussion in chapter 4, and the chapter 5 is for right for persons with mental illness. So you can see that the what are the rights are being given to them: right to access to mental health care, right to community living, protection from cruel, inhuman, degrading treatment, equality and non-discrimination, right to information, confidentiality, right restriction or release of information in respect to right to access medical record. This is regarding the confidentiality and privacy of the patient. Right to personal contacts and communication. The person can contact and communicate personally with any of the person who he or she want to communicate during the hospitalization. And right to legal aid. So you can see that all the rights uh, which are being enjoyed by the normal people are also being given to them. It is written in this act. They should be they can also be given these rights. So MHCA is more the right oriented and right oriented of the patients, right? What the rights they can have. Previously, it was not, and the United Convention has ensured that the rights of person of mentally ill people be preserved under the Act. Chapter 6 talks about the duties of appropriate government, 7 about the Central Mental Health Authority, and 8 is for State Mental Health Authority. Chapter 9 is for finance, accounts, and audits. Chapter 10 is regarding the mental health establishment. So, how the establishment can be registered, procedure for registration, audit, inspection, uh, what are the procedure to appeal to High Court, and all the maintenance of registers and records. Chapter 11 is for Mental Health Review Board, which has an equivalent power as of magistrate, and above that there is only High Court. One can appeal against the medical board in the High Court only. This is regarding the chapter 12 is regarding the admission, treatment, and discharge of the patient. And I have picked up the specific section 94 for the emergency treatment, which you may face in your emergency medical setup. Any medical treatment, including treatment for mental illness, may be provided by any registered medical practitioner to a person with mental illness, either at a health establishment or in community, subject to informed consent of the nominated representative, where the nominated representative is available and where it is immediately. Okay, so if one has being treated in medical emergency setup, so nominated representative is immediately be informed regarding the person is being there in the emergency setup for the treatment, or otherwise if nominated representative is not in not available, and this is a death or irreversible harm to the health of the person, one can act in the emergency department to treatment of the person, or the person inflicting serious harm to himself or to the others. The immediate action can be taken. The person causing serious damage to the property belonging to himself or to the others. This is also emergency condition and be treated promptly. And the condition is believed to flow directly from the person's mental illness, not because of the other causes. The explanation is, for the purpose of this section, emergency treatment includes transportation of the person with mental illness to a nearest mental health establishment for assessment. This is also included in the emergency treatment part. The transportation till the patient transported to the mental health establishment, that period of management will also be considered under the emergency treatment. The second point is, nothing in this section shall allow any medical officer or psychiatrist to give the person with mental illness medical treatment which is not directly related to emergency treatment specified under subsection 1. Okay. Any kind of other treatment cannot be given. Nothing in this section shall allow any medical officer or psychiatrist to use electroconvulsive therapy as a form of treatment. So in the emergency part, electroconvulsive therapy is prohibited and cannot be used if it is indicated to. The emergency treatment referred to in this section shall be limited to 72 hours or till the person with mental illness has been assessed at the mental health establishment. So the time duration for emergency treatment is 72 hours, and within the 72 hours the person should be sent to a mental health establishment for further assessment and for management, and whichever is earlier. But there is a different condition like disaster and the emergency declared by the appropriate government. The period of emergency treatment referred to in this subsection may extend up to 7 days in these two conditions. The chapter 12 is also talks about the restraints and seclusion. So it should also be known to you that what is there for restraint and seclusion. It is applied when it is the only means available to prevent imminent and immediate harm to the person concerned or to the others. It is authorized by the psychiatrist in charge of the person's treatment at the mental health establishment. In these conditions, seclusion or restraint can be applied. shall not be used for a period longer than it is absolutely necessary to prevent immediate risk or significant harm. So the treating mental health professional is responsible for ensuring that the method, nature of restraint, justification for its imposition, and the duration of the restraint are immediately recorded in the person's medical note. The restraint shall not be used in a form of punishment or deterrent to any circumstances. It should not be used for punishment or to deter any other circumstances in the management. The nominated representative of the person with mental illness shall be informed about every instance of the restraint within a period of 24 hours. So NR must be informed. The person should remain under regular ongoing supervision of the medical personnel at the mental health establishment. Report of restraint and seclusion must be sent to the concerned board on the monthly basis. Another noteworthy points are central authority may make regulation for the purpose of carrying out the provision of this section, and the board may order a mental health establishment to desist from applying restraint if the board is of the opinion that mental health establishment is persistently and willfully ignoring the provisions of this section. Be cautious regarding the restraint and seclusions also. Chapter 13 talks about the responsibilities of other agencies like police department, the judicial department, and the other various departments, what are their role and responsibilities. The 14 is regarding restriction to discharge function by the professional not covered by the profession. This means no mental health professional or medical practitioner shall discharge any duty or perform any function not authorized by this act or specify or recommended any medicine or treatment not authorized by the field of his profession. So one mental health professional cannot go beyond his capacity and his training. He cannot take or pursue other uh, modalities of treatment for the disorders and the conditions which are not specified by his profession. Chapter 15 is about offences and penalties uh, in this act, and chapter 16 is for miscellaneous things. So this is regarding emergency treatment and what is provisions under Mental Health Care Act. So one should be aware regarding the emergency treatment, the seclusion restraint, and the other roles and responsibilities under Mental Health Care Act. So thank you.